if you're living with chronic pain, you know just how debilitating it can be. You wake up in pain, you pick up your children and grandchildren while you're in pain, and you fall asleep at night with the same distracting, consistent pain. And you know what? You're not alone. Pain affects more Americans than diabetes, heart disease, and cancer combined. And while prescription pain medications are an important component of pain management, the reality is these products are prone to both abuse and misuse. In fact, more than 12 million people reported using prescription pain medications non-medically in 2010. In addition to managing chronic pain, people affected by pain and the healthcare professionals who treat them must navigate a complex treatment landscape. Well, joining us today to tell us more are Paul Gelino, the Executive Director for the U.S. Pain Foundation, and Dr. Melanie Rosenblatt, the Medical Director of Pain Management. Thank you both for joining us this afternoon. Now, Paul, I'm going to start with you.
Thanks for having us.
Tell me how your life has changed since you started experiencing pain.
Well, my life has changed. Before chronic pain, I was a chef caterer. 12 years ago, I was lifting a box, twisting, and I broke my back, which severed my sciatic nerve. And that began my chronic pain journey. Since then, I've had chronic pain, and my life has changed.
All right. So what sort of issues do patients like you face when it comes to adequately trying to treat this chronic pain?
Well, people with pain face many issues. One of those issues is access to proper medications and treatments. Because pain is so complex and so subjective, it's very hard to find the correct treatment. So we work really hard to make sure people understand that they're educated, empowered, and advocated for, so they understand what it's like to live with chronic pain. We recently worked on a survey together with the American Academy of Pain Management, which was sponsored by Teva Pharmaceuticals, to help people with chronic pain to start the conversation on abuse. And the survey results were very compelling because we realized that most people with chronic pain, as well as most healthcare providers, feel like it's their responsibility to the abuse of prescription pain meds in America, as well as they're very uncomfortable to speak about it.
Now, you talked about educating people on what chronic pain is, because not everybody knows what it feels like. Kind of take us through it. What's it like?
Well, living with chronic pain is, it's so subjective. So for me, pain is very debilitating many days. Pain can control your life. It's very depressing. It's very, it takes over your life. Other people handle pain in different ways. So pain is very subjective to the person who has pain, and that's why it's so complex to treat. One of the biggest steps was connecting with other people, learning that I need to have a conversation with other people as well as my healthcare provider for the best management of my pain. Treatment is one thing, working through the issues and being connected to others is a huge part of your pain journey.
And your body gets used to these medications. How do you avoid addiction?
Well, we focus solely on abuse of these pain meds, and so a person with pain, takes responsibility for abuse of pain meds, as well as the healthcare provider. So we really work to make sure people aren't abusing their meds and that they have a conversation with their doctor.
Dr. Rosenblatt, how can patients and doctors help reduce drug abuse?
First of all, understanding what drug abuse, prescription drug abuse is and what it entails. And the approach to reducing drug abuse is multifaceted and requires all of the stakeholders in this to take an active role in responsible pain management.
But not everybody abuses pain medication. Is there any particular kind of person who does over someone else?
Well, the way to recognize abuse is to first understand what it is. And like you said at the beginning, more than 12 million people in a CDC study, more than 12 million people abuse prescription pain medication. That's not an insignificant number. So some of the ways to curtail prescription drug abuse is, one, to recognize what it is and what it isn't.
All right. And lastly, Paul, I want to ask you if you could say something to someone out there who's feeling hopeless because they are living with chronic pain day in and day out. What would it be?
Tell that person that there is hope and that you can still live a fulfilling life even though you have pain. There's plenty of resources and materials out there to help you on that journey, and that they're not alone.
All right. Paul, Melanie Rosenblatt, thank you so much for that. Very good information. Of course, if you'd like to learn more about resources regarding drug abuse and chronic pain, visit WBOC.com. Click on our picture at the top of the page.
So, of course, the thing about drug misuse and abuse is that nobody plans to get addicted to prescription pills. It just kind of happens. So it's important to take precautions against it. And one thing that you can do to protect yourself and your loved ones is get rid of the prescriptions that you no longer use. You don't want to leave them in your medicine cabinet for sticky fingers, but we're always told, don't flush them down the toilet or drain, don't throw them away. Now some pharmacies are even charging people who want a safe bag to dispose their pills, but there is another safer option. Joining us today to tell us more about it is Mady Barker, who's the Behavioral Health Director at the Somerset County Health Department. Thank you so much for joining us today.
Thank you.
So we're talking about pill drop-off boxes,
right?
Tell me about that real quick.
In Somerset County, we have had some prescription drop-off boxes for a number of years at our law enforcement facilities.
Right.
And this year, we have been able to expand to pharmacies as well. The DEA has expanded their regulations so that pharmacies can also have them. They look somewhat like a mailbox where you can go and deposit unused or expired medications. And keep them out of the hands of those who could abuse them.
Okay, so follow me on this. I've got some that I don't want anymore. How does this work? What do I do?
Okay, you would simply take them out of your medicine closet, go to one of the local drop-off boxes in Somerset County. It's at Princess Anne Police Department, the State Police, the Chrisfield Police, and soon they will be coming to Caremore Pharmacy and Princess Anne, Marion Pharmacy, and Chrisfield Pharmacy. It's completely anonymous. No one is going to ask you to fill out any paperwork, ask for your name. You simply open like you would to mail a letter, drop them in, and that's it.
That's it, just walk away.
Yep, safe, secure, anonymous.
Now there's something similar to this in Sussex County.
Okay.
That works just about the same way. So just in case you've seen that, then you know how this works. Georgetown Police recently received a grant where they purchased a drug collection unit. You see it there. Residents are encouraged to drop off unused pills in this bin. Why, though, do you feel like these programs are so important?
Well, we're trying to limit both the access and availability of prescription pain medication. One statistic is that the U.S. population is 5% of the world population, but we actually consume 80% of the prescription pain medication.
Oh my goodness.
So we know there are a tremendous number of pills out there, most of them prescribed for very legitimate reasons. But when they sit in the medicine closet and start to collect, again, they can lead to misuse. So if people are not able to have access to them, there are not as many available, hopefully we will prevent some of the drug misuse and abuse that has been a major problem recently.
What can I drop off?
You can drop off all of your pills, your powders, your liquids, over-the-counter medications, pretty much any medication that has either been prescribed or you bought over the counter.
What about vitamins?
Vitamins are fine.
Those are fine?
Vitamins are fine too.
What can I not drop off?
Well, you cannot drop off any type of needle. You can't drop off any type of medication that has iodine thermometers with mercury in them. Your asthma inhalers are not permissible either.
Okay, so I'm sorry, tell me one more time, where are these available?
Okay, in Somerset County, right now, you could go to the Maryland State Police Barracks in Princess Anne, the Princess Anne Police, the Chrisfield Police. You can also take them to the Sheriff's Department, and very shortly, you can take them to Caremore Pharmacy, Marion Pharmacy, or Chrisfield Pharmacy. So we've got the county covered.
Okay, there are people that need their medications, but we've got to keep them safe. We've got to keep them out of the kids' hands. So there are safe ways to store our medications.
Absolutely. We need to make sure that medicines that can be abused are stored in a locked closet cabinet where only the person who has the prescription can have access to them. We also recommend that you keep all medications out of the reach of children as well as pets. And that you use your medication only as it was prescribed, take it for the amount of time it's prescribed and the amount prescribed and at the certain intervals, and never share a medication. The prescription was written for you. That doesn't mean it's safe for somebody else in your home.
Keeping it in the original bottle is pretty important.
Absolutely, absolutely. And when you return them, they should be in the original bottle.
Should be in that same bottle. Mady, thank you so much for talking to us this afternoon.
Thank you.
Now, if you'd like a list of drug take-back box locations or you want to learn more about the program, just go to WWOC.com and click on our picture They're at the top of the page. Now, as we said, a lot of people do need to keep their medications because they rely on them, including many stroke survivors. Ask anyone who's had a stroke, they'll tell you the effects can be debilitating. So up next, we're going to meet a few stroke survivors who say a support team is key. But don't be mistaken, stroke doesn't just affect adults. There are many children who've also had one. We're going to hear the story of a 15-year-old stroke survivor and learn just how common that is. Delmarva Live. We'll be right back.